Why does lymph node TB diagnosis often requiring a biopsy? Imagine trying to solve a mystery where the clues are hidden deep inside a tissue sample. That's exactly why diagnosing lymph node tuberculosis often needs a biopsy. Lymph node tuberculosis, also called tuberculous lymphadenitis, is a form of tuberculosis that affects the lymph nodes, which are part of your immune system. And like lung tuberculosis, it can be tricky to identify because the symptoms are often vague and the bacteria are present in very low numbers. A biopsy involves removing a small piece of the affected lymph node. This tissue gives doctors a closer look at what's happening inside. When they examine it under a microscope, they look for specific signs of tuberculosis, such as caseating granulomas, which are areas of tissue death surrounded by immune cells. They also try to find acid-fast bacilli, the bacteria that cause TB. These features are often not visible through blood tests or sputum samples, especially when the bacteria are scarce. Histopathology, or looking at the tissue under a microscope, is highly sensitive for detecting TB in lymph nodes. It can identify characteristic changes even when other tests fail. Studies show that histological examination can detect TB in over half of lymph node samples and has a sensitivity of more than 90% compared to culture, which is considered the most accurate test. This means that even if bacteria are hard to find, the tissue changes can still point to tuberculosis. A biopsy also allows multiple tests to be done on the same tissue sample. Besides histology, doctors can perform cultures to grow the bacteria or use molecular tests like PCR to detect TB DNA. This comprehensive approach helps confirm the diagnosis and rules out other causes of swollen lymph nodes, such as cancer or other infections. Less invasive methods like fine needle aspiration can be used, but they often provide only a small amount of tissue, which might not be enough for a definitive diagnosis. Core needle biopsies give more tissue but still may not be as thorough as an excisional biopsy, where the entire lymph node, or a large part of it, is removed. The excisional biopsy provides the best tissue architecture for accurate diagnosis. Since enlarged lymph nodes can be caused by many different diseases, a biopsy helps distinguish tuberculosis from other conditions. It reveals specific tissue changes and can confirm the presence of Mycobacterium tuberculosis through culture or molecular testing. This is crucial because treatment for TB is different from treatment for cancer or other infections. Getting an accurate diagnosis with a biopsy is essential for effective treatment. Lymph node tuberculosis can respond more slowly to therapy than lung TB and may have complications. Confirming the diagnosis ensures the right medications are used and helps avoid unnecessary treatments. In summary, a biopsy is often necessary because it provides the most reliable way to detect lymph node tuberculosis. It allows direct visualization of characteristic tissue changes, enables multiple tests on the same sample, and helps rule out other causes of lymph node swelling. This comprehensive approach guides healthcare providers to make accurate diagnoses and start the most appropriate treatment, improving patient outcomes. Always consult a healthcare professional for personalized advice and diagnosis.